And I think in news that'll be welcomed by all Victorians, 100% of those cases were in isolation for 100% of their infectious period. That means that they're not a risk to public health. The strategy is working, and that trend that we hope would stabilise, if you like, and would start to form up into a true trend, has in fact done that. We started this outbreak with less than 10% of people who were turning positive having spent their time locked away. That's the nature of how outbreaks work. Because we've made difficult decisions to lock the state down, we've seen that number steadily grow because we've limited movement, and, can I say, people have done an amazing job. More than 20,000 people isolating at home, protecting themselves but also protecting every other Victorian family. So we send a message of gratitude to them, but also a very serious message. The day 13 tests are rolling around for literally thousands of people. There's a couple of thousand, 2,500 people yesterday, I think, that went through that day 13 process. You've got to get a day 13 test, but you've also got to be cleared by the Department of Health. You have to have both. You have a negative test and be cleared. And the clearance comes via a phone call and then an email. A letter is sent to you. Please don't just assume that because 13 days have passed or 14 days have passed, you're in the clear and you can go about your business. We're seeing people as late as day 13 and day 14 turn positive. So this is a very live issue, a very challenging issue. So we'll just keep working through that. There's a big team of people who are doing that work, and I'm grateful to them as well. But to more than 20,000 Victorians who are at home, not just in lockdown, they're at home in ISO, can't leave the house for any reason. We thank them very much for the work they're doing and the contribution they're making to our collective fight against this virus. While I'm doing thank yous, can I thank the 32,385 people who went and got tested. We got their results overnight. They're the results that we're reporting today. That takes to more than 500,000 the number of tests that have been conducted since this outbreak started. That is an amazing effort. And again, we're deeply grateful to everyone who has registered the most minor symptom and gone and got tested, all the way through to people who were at a Tier 1 exposure site or at any of those exposure sites and went and got tested as they were asked to do. It's such a powerful part of our response to this virus. In broader terms, the strategy is working, but it's still too early for me to be able to tell Victorians what will happen at midnight on Tuesday night. There is still a couple of days to go, and as we know, we saw with an apartment block yesterday, the day before, things can change. This is fast moving, it can be quite dynamic, and you can be thrown off course. At this stage, though, things are going well, and that is a testament to a very large group of people who are working incredibly hard to track, to test, to isolate, to trace this down, to find every chain of transmission, but also thousands and thousands of Victorians who are doing the right thing, in fact millions of Victorians who are doing the right thing, following the rules, and particularly those who are isolating at home away from everybody to keep everybody safe. We're very, very grateful to them. Speaking of people that we can be grateful of course, there are all of those I've listed and many more. To those yesterday who very selfishly protested, that's not the behaviour we want to see. I'll leave it to Victoria Police to go through what they're doing about that in relation to further work that they may do. There were some fines, there were some arrests made, I think. But we don't want to see people out and about selfishly putting their point of view ahead of the health and well-being of others. Everyone is entitled to an opinion, but you're not entitled to put other people in danger. And that's what yesterday was about. Ultimately, selfish behaviour that puts many, many other people in real danger. I just hope that it doesn't have an impact on cases and doesn't have an impact on the sort of rules that we all have to live under. But it is very difficult to try and shut a protest like that down without that itself becoming an infection control nightmare, having to physically handle people and all of those issues. I think people understand that Victoria Police did their very best. But, we can't vaccinate against selfishness. And these people should be ashamed, absolutely ashamed. It's just wrong. If you want to protest against the virus. Stay at home, do the right thing, and let's get through this together without selfishly putting other people in harm's way. Probably said enough about those people. I don't really deserve much more attention than that. But the Victoria Police are doing their work, and I'll leave them to update you. More broadly, there'll be meetings tonight, meetings tomorrow. We'll be looking at all the data. Health officials will come to us with advice as late as possible. in terms of the most accurate picture, and then if we can give people notice, we will. But things are strong, things are solid, but things can come from nowhere in these next couple of days. So we just need to be. We don't need to. We shouldn't become complacent in any way. We have to see this thing through, and hopefully we can be in a position to ease some of these restrictions, ease some of these rules from midnight Tuesday night. But we've got to see what tomorrow's numbers look like and Tuesday's, as well as continuing to follow every lead, chase down every case, try and limit every chain of transmission. Just finally, again, can I say to all of those 20,000+ people who are isolating at home because they were either in the company of someone who was positive or they might have been, you've got to get a day 13 test. It's got to be negative, and you've got to be cleared by the Department of Health. And I thank each and every one of you and your families for the amazing job you're doing to protect everybody. But that process is really important because people are turning positive as late in their isolation period as the 13th and 14th day. That's the other wicked part about this Delta variant. Beyond that, we are well placed. We just have a little way to go, and we will share with all Victorians what's possible in terms of opening up as soon as we possibly can. I now might ask Jerome to run through those cases and some other outbreak details, and then we're happy to take any and all questions you have.
Thank you, Premier, and good morning. So 11 new community cases of coronavirus in Victoria here on day 14 of this outbreak. That takes to a total of 179 community cases. 7 of those cases are in hospital, 2 are in ICU, one of whom is on a ventilator. And we, of course, send our very best wishes to everybody who is currently in hospital and, of course, recovering from coronavirus. 32,385 tests in the last 24 hours. Of those, 94.5% of those test results are coming within 24 hours, and 542,000 tests in total since the start of this outbreak. And as I said, we're on day 14. Of the 11 positive cases, I'll just run through those briefly and then come to our clearance processes. So of the 11 cases, we have 4 associated with the Miss Frankie's restaurant. 3 of those are patrons who were there on the night of the 15th of July, and 1 is a household contact of somebody who was at the restaurant. So that's 4. We have 3 cases associated with Trinity Grammar. 1 of those is a student, another 1 is a parent of a student, and 1 is a household contact of a staff member. That takes us to 7. We then have a single case at Bacchus Marsh Grammar, a single case associated with the Westgate Tunnel construction site, 1 at Young and Jackson's, and 1 at Amy Park. And all those 4 cases are household close contacts of other cases, so we are further down the chain. That takes to 11 our total cases for today, and as the Premier said, all of those were doing their quarantine, and again can I add my thanks to them because that's why the quarantine is so important. A number of these cases had already tested negative earlier in their isolation period. We're now seeing people who are doing the hard yards, staying true to that 2 weeks of isolation, and it's so important that they do to us make sure we run all these last remnants to ground. On the other clusters, so pleasingly for the City of Hume cluster that we've discussed, a total of 15 cases associated with that, but no new cases over the last 3 days. Over 80% of primary close contacts associated with that cluster have returned a negative test result. The Phillip Island outbreak, again 9 cases in total associated with that, no new cases for the last few days, and over 2/3 of contacts associated with that outbreak have returned a negative test result. For Mildura, and again, my thanks again to the whole Sunraysia community for their fantastic work this week. I know it's been a very, very challenging week, both for our health services up there and, of course, the wider community, but huge testing numbers. We only have 4 cases, all within 1 household. We've seen no other positive cases over the last 4 days, and 3/4 of those associated with the outbreak have returned a negative test result, as I did of many other thousands of people in the Mildura area. We will, of course, continue to support the community over the coming days, and at least 700 people are in isolation in that area over the next week at least. We discussed yesterday briefly Prahran Market. Pleased to say 1,100 primary close contacts have been identified. 2/3 have already returned a negative test result. No positive cases have been identified at this point in time. Probably the most significant activity for us today is the Lacrosse apartment building. Many of you were there yesterday, as was I, and again this morning. We have a total of 312 apartments in that building, over 21 floors. Yesterday, we were able to test 214 of the residents over around 8 of those floors. And my thanks to all those residents for coming out yesterday and getting tested. There's a dedicated testing team on site. And again, today, we have 4 testing teams on site on a very windy and cold day outside that building. We know we have already 32 negative results for the people who were on the floor, same floor as the apartment where the positive case was. They've all tested negative, as have the household contacts of the people in that apartment. The case themselves is in hotel quarantine, and my thanks to them for their work in that regard. We will continue testing all the remaining residents of the apartment building today. We are treating it as a Tier 1 exposure site, and we're still conducting our ongoing investigations, and we'll work with that residents' community to do so. My thanks to them for their stoicism. I know it's a hard thing to do when we ask you to lock down for 2 weeks, but again, as we've seen many times, the curveballs we see with this virus, particularly late in the day when we think we've got it all under control, we cannot afford the risk of these things flaring up at the last moment. So we will continue to work with them to get this under control. Yesterday, we cleared 2,400 primary close contacts who had been doing the 13, 14 days of isolation. That now brings to a total of 4,300 the number of primary close contacts who have now completed their isolation, who completed a day 13 test, and who had a phone call from my colleagues in the Department of Health to confirm that they can now end their isolation, and who received written confirmation to that fact. Can I please say to the other 20,000 people who are isolating, I know it's tiresome, I know it's long, and particularly as you get to the end of that, you just want to be done with it. Please, you will be contacted to confirm when your day 13 test is due, although I'm sure you've got it marked on the calendar already. We will certainly contact you when your negative results come through to confirm that you are able to relieve your isolation. We cannot afford the risk at this very late stage of people self-declaring and self-releasing from isolation. Yesterday, we made over 700 home visits to people who are isolating and old returnees from red zones. We will also be visiting people who have not yet cleared a day 13 test to ensure that you actually do. The consequences of not having a day 13 test is you start another 14 days of isolation. So I respect the fact that some people, a very small minority I suspect, may not want to have a test at all at day 13. That will mean you have to do another 14 days of isolation, so there is no risk to the wider community. With that, can I add my thanks to everybody who's been involved in this ongoing outbreak management. It is so important we get a hard finish to this outbreak. So there's still some yards to go. We will continue to do that over the coming days, and we'll of course keep you updated with any other developments. With that, the Premier and I will take any comments and questions.
I've got a question about those who are testing positive so late, as the Premier mentioned, day 13 and 14. What, you might not have exact percentage, but is it many? I mean, is that a concern that there are that many people?
Yeah, look, it's not many, and as the Chief Health Officer has discussed many times in the past, we see a certain profile. A number of people would test positive in the first 3 or 4 days from exposure. It is relatively rare to see people turning up on day 12 or day 13 testing with a positive result, but it does happen, and it's a significant. The contacts I've just gone through, most of those are well advanced into their infectious period and are still testing positive. So for that relatively small minority, but it's an important minority because that's how these dying embers catch fire again. The risk for us is that we do all the hard work, we get the thing under control, and we leave some dying embers out there, so we have to get them completely doused down before we open up again.
Have there been issues with people self-declaring in the last couple of days?
No, not at all. Look, and as we've said all the way through this outbreak and previous outbreaks, I mean, I think Victorians, we know through the hard work we had to do last year and this year, we do know how to run outbreaks, and we know what it means to isolate, and we know what it means to actually get this thing under control. And we've seen phenomenal levels of compliance with people isolating, people getting tested, and people just doing the right thing under the lockdown environment. So yesterday, as I said, around 700 home visits. I think there were 2 people who weren't complying completely with the requirements. They've been referred on to Vic Police. So we're on the whole, I think, really pleased and very grateful for the support we're getting. And I think if we continue to work together as a community, we'll get this one under control, as we have done a number of times before.
And we know there are many thousands of people who don't seem to have been getting tested in their eye, so they're waiting for the day 13 test. Yeah. Are the household contacts of those primary close contacts also required to get the same day 13 test? Because if they picked it up later in the 14 days, they may still well be infectious, or in the early part of their infection. Sure. Is the whole household needing to be cleared if that person hasn't got a test earlier in their ISO period?
That's right. So look, I think the first thing I'd say, Paul, is that actually we've seen really high levels of people coming forward to get tested early in their isolation period. well over 80%, going up to 90% for some of the key exposure sites. So again, that's consistent with the pattern we've seen in other outbreaks. I think secondly, of course, if you choose not to get a test until day 13, that means all your secondary close contacts are also having to be stuck down. One of the advantages of getting tested early is that we can then remove your secondary close contacts and let them go, and they can continue to normal life, or to relatively normal life. If you choose not to get a test, then all those secondary close contacts need to stay locked down. We've got 14,000 secondary close contacts right now that are isolating, along with those 20,000 odd PCCs.
Brian, is there an argument to make that first test when you first go into isolation as a primary close contact mandatory, given that it would give us a better idea of the situation and possibly impact on whether we're released from lockdown?
Look, if there was a problem, then we do something about it. But again, as I said, we're seeing over 80% of people who are in isolation getting those tests early on. We've got a testing system, a fantastic testing system that is more than capable of handling that testing pressure. But look, for the sake of a small minority of people who choose not to get tested early on, we pick them up at day 13 anyway. And that for me is the key thing. It's the isolation that's important, and it's clearing that day 13 test at the end and being cleared by the Department of Health. That's important, and that's what we're focusing on.
Why are you confident that the 30 or 25% of MCG and AMI contacts who have not been tested, why are you confident that there are no positives among them and their chains of transmission are unknown until day 13?
Well, I'm not, look, Paul, it's entirely possible that there may be positives amongst them, but they'll be caught at the day 13 test mark. The crucial thing to this is them doing their isolation. As I said, over the last few days, we're doing over 700 home visits every single day. We're chasing up all the people who should be in isolation, and we're finding the people who are doing the right thing. So the level of contact we make, we phone people, we send messages to people, we check in to make sure they're okay. We provide extensive support, $450 isolation payments if you need to get your test, a whole series of other financial supports if you need it, if you have to do the isolation. So I think the Victorian approach is to provide extensive support to people to make it easier for people to do the right thing, and as a result, people by and large do.
But if a lot of those primary close contacts are only being released from lockdown this weekend, do you agree that that could have an impact on whether our lockdown is lifted or extended if we see all of these new cases emerge, or are you confident, given that they haven't been infectious in the community?
Well, the crucial thing is they're not infectious in the community because they're in lockdown, they're in isolation. So if as we've seen today, we've seen 11 positive cases come forward today, all people that are in isolation. They don't represent an onward risk. Obviously, we're concerned about their health. We want to make sure they're well. We want to make sure they're getting supported, but they're not presenting a wider community risk. So if we've got people coming out of MCG or Amy Park or anywhere else who are testing positive on day 13, I mean, it's regrettable because they'll have to kick on and do another 14 days of isolation, and we'll support them to go and do that.
All the residents in the Lacrosse apartments at Docklands, are they all required to isolate for the full 14 days?
Yeah, so at this point in time, the Lacrosse apartment building is a Tier 1 exposure site. So we sent in our infection prevention control teams there a couple of days ago. We've had testing on site all day yesterday. We're continuing to assess the dynamics of movement within that building. We know the positive case, and one of the benefits of the building is it has a very good smart card system in terms of access. We know the positive case made a total of 5 movements within the building during his presumed infectious period. 2 of those movements were to go and get tested, so coming out and coming back. One of them was to let somebody in, a neighbour in, and one of them was to go and get some food, and one was to put the garbage out. So we've got a good track of his movements in the building. We're narrowing down the number of people who we may have been exposed to during that period in time. But out of an abundance of caution, at this point in time, the whole site's a Tier 1 exposure site, and people will need to do their isolation until we advise them of otherwise. Lots of testing happening there yesterday, lots more happening today, and we are determined not to let this, having got this outbreak, on the deck, we're determined not to let it get away again.
On the protest, how would you know if that is a super spreader event? Because given the people who were there may not be following your advice to go get a test, and how long would you expect it to take to show up if it was a super spreader event?
Look, it's obviously primarily it's a judgment that Brett and the public health team will have to make around how we see the consequences of that protest. But clearly, the whole point of the lockdown provisions here in Victoria is not to see thousands of people congregating in an uncontrolled way that we all saw yesterday. We are concerned about it. We may have to sit back and watch and see what results come through in the coming days. We'll have to see what the dynamics are going to be. But it's a curveball we didn't need at this point in time. And whilst I'm on it, what's so frustrating is that when you've got 6 million Victorians in lockdown, when you've got 32,000 people getting tested, you've got 20,000 people in ISO, 17,000 people getting vaccinated, a small minority having a self-indulgent tantrum is just a really frustrating thing at this very critical point in time.
Could it extend the lockdown if there are cases amongst it?
Look, not a decision for me. Obviously, the public health team will review all the evidence over the coming days. We've got, as the Premier has said, important material to review today, tomorrow, right up to the end, and we'll keep doing that as we've done every day since the very start of this.
The Premier, actually, is 2 days enough, given the scenes we saw yesterday in the CBD? Is this enough time ahead of making announcements on Tuesday to see whether that was a super spreader and what could happen?
I think we're going to be in a position to receive very detailed public health advice about what's safe to do at midnight on Tuesday before then. And it's my hope that we're able to ease some of the restrictions that we're living under. We will deal with the most complete picture that we have. So that's why we always wait till as late in the cycle as we possibly can. Let's wait and see what comes out of yesterday's protest. I hope nothing comes out of that.
But there are people who might not get tested. They're people
well, indeed,
who
and that's why we won't be remaining locked down indefinitely until something doesn't happen out of a protest yesterday.
Can I just say,
we can only go on the information that we have. We've got more than 500,000 people testing. Today is essentially a 0 day because everybody who tested positive was locked away in ISO for 100% of the time they were a risk to public health. We want that trend to continue. Neither you nor I nor anybody else can necessarily, with any great certainty, work out what comes of yesterday's protest. I'd argue not much comes of it. But it is a risk that none of us needed to take, and I would just appeal to anybody who's frustrated, and I get that people are frustrated, but it seemed to me that they were protesting about a whole lot of things yesterday, not just coronavirus, but the global world order and vaccines and all sorts of different things. That is self-indulgent, it's selfish, it's wrong, and Victoria Police are having a close look at everybody who was involved. It's no way to behave, but I don't believe it will fundamentally change things, but I wouldn't want that to be read as any sort of encouragement for people to go out there and do this. They're risks that no one should be taking because you're not entitled to. No one is entitled to put other people at risk.
But why won't it change things? Why are you so confident, given that we've been told Delta is so infectious it can pass from me to that person without us being close together? Yep. You've got thousands of people in the street. What we're seeing is one person there could be infectious, so why are we confident?
And that's a risk, and we'll have to wait and see. That's why I'm not today. Don't misunderstand what I'm saying. I'm not standing here today saying the rules are all coming off at midnight on Tuesday. I can't say that because we've got tests that are being done right now and results won't come through till tomorrow. Then there'll be Monday's activity that won't be clear to us until Tuesday. It could be a problem. I hope it won't be. I can't predict what positives there'll be tomorrow. I wish it had not happened.
Yeah.
And short of literally trying to, physically arrest thousands and thousands of people, which would again be an incredibly challenging thing to do from an infection prevention and control point of view, none of us can be certain. But on the data we have now, on the trend that we've seen unfold over recent days, the strategy's working and we are on track.
But last Sunday, just a sec, last Sunday we stood here and had the same conversation because we were due to have lockdown lifted on the Tuesday, yes. But we didn't have a protest on the Saturday. And that's rightly, correct. You stood here and said we can't tell you yet. So why are we allowing the same amount of time when we didn't have a protest last week?
Hang on a second. There are a number of differences between last Sunday and this Sunday. We didn't have 11 cases, all 11 of whom had been in ISO for 100% of their infectious period either. So, some things are known, some things you can control, some things you'll never have a 100% risk-free environment. That's the nature of this, and that's why we won't go from 5 reasons to leave your home in a lockdown at midnight on Tuesday to do whatever you want, wherever you want, normal. There will still be some restrictions in place. The exact nature of that's got to be worked through over the coming days. So, look, I think we're kind of making the same point. It is a risk. We can't eliminate all risk, and short of remaining in lockdown for a full another 14 days, which would be the full gestation period, the sort of life cycle or 2 life cycles of this virus. Now, we are not going to do that, but I wouldn't want anyone to see that as me encouraging anyone breaking the rules. Like I said, we didn't need it. Let's hope it doesn't have an impact. We'll go by the data we have and the evidence we have, and hopefully We don't see any more of that kind of behaviour.
It's extremely unlikely that
It just puts all the work that everyone's done. It just puts all the work that everyone's done at risk. Just on the day 13 thing, I would just say to those people who are in ISO, and we've got a whole bunch of friends from the southeastern suburbs from our local community who are in ISO at the moment because of school exposures and some stuff in Oakley and all over the place in that southeastern area. And my experience in talking to some of them who are getting close to the end of their 14 days, they want their 14 days to count. So they're getting their tests, they're getting cleared because they want what they've given to all Victorians, their sacrifice, the important contribution they've made, they want that to count for something. And they do know that people can turn positive very late.
So, Premier, just confirming, the protests will not have any impact on whether Victoria's lockdown is extended, even if it's by a couple of days?
No, I can't say that, because there could be a whole bunch of positive tests tomorrow, or there could be a whole bunch of positive tests on Tuesday.
So if there are positive cases that come from the protest, there's a possibility that our lockdown could be extended?
I put it to you this way, and I'm not playing word games with you, but like the easiest thing for me to do is to refer to other protests that have occurred where there was no transmission. But I wouldn't want that to be read as an invitation to go out and protest. We have had protests before, and there were no infections from that. That was pre-Delta. We're kind of going around in circles here. We will go and we'll be guided by the test results that come in tomorrow and Tuesday, regardless of where people got it. That's the best way I can answer it. I can't tell you what's going to come out of that protest. I wish it hadn't happened. The people who are involved potentially have put things at risk, but let's just push on. We're going to get to midnight Tuesday and hopefully we can make some decisions where rules can be eased. It won't be risk-free, but it will be based on detailed advice and expert opinion and acceptable risk, and hopefully we can start to take those steps back to a COVID normal.
I know we are going back into Victoria, but just on the protest, would
Yes.
you agree that it's easy to look at a worst-case scenario for something like that, but would you agree that given we haven't had a mystery case, all cases are in ISO, all cases have been linked, would you agree it's extremely unlikely there was a positive case there?
Well, I would have thought it was quite obvious that all our cases are linked. All our cases in recent times, or at least the vast majority of them, have been in ISO during their infectious period. I can't rule out, none of us can rule out that there is a case out there somewhere who hasn't gone and got a test, right? None of us can rule that out. And there's a reason why there are rules against large gatherings in the middle of a pandemic where you've got the deadliest, most infectious strain we've ever seen, where we don't have the community, anywhere near enough people in the community having been through the vaccine program. And if you look at Sydney, you've got hospitals full of 40-year-olds. Like, protests are not a smart thing to do. They're the wrong thing to do. I can't predict whether it'll have a material impact or not, but I think we would take some comfort from the fact our cases are linked, because it hasn't got out of control, it hasn't gone wild, because our contact tracers and Victorians have done an outstanding job. What's more, we've got people tucked away in ISO during their infectious period, no risk to others. Let's hope that there wasn't a case out there. Let's hope it wasn't bubbling along outside the net that we've cast, only to then be spread at a fundamentally selfish and illegal protest yesterday. That's my hope. Can I be certain of that? No, none of us can be. But that's why we're not looking for absolutes here. We're not looking for we'll stay shut till there's zero risk, because I don't know that we'll ever get to a place where it's zero risk. There'll always be a residual risk that there's a case out there somewhere, or there's a breach somewhere in the future. That's why it's so challenging to live with this virus. You really can't, particularly Delta. You've got to have such low tolerance for any case numbers, and you've got to shut down fast. I think we're in the process of proving that, as is Adelaide.
Is CCTV being used to identify who these protesters are? And is it your hope that they will be fined? Why weren't they fined yesterday?
I would assume so. As for what investigative methods Victoria Police use, you're probably best to speak to them and their approach to these things. They'll be able to talk to that. To the extent that they want to tip people off, they might be able to tell you a little bit about that. And I think, frankly, yesterday, the last thing you want is to have police members having to, physically, arrest people. That's an infection prevention and control nightmare, and could potentially make a difficult situation, a bad situation, much worse.
Is it your hope that they'll face some sort of justice?
Sorry?
Is it your hope that they will face some sort of justice, though?
Well, it's always my hope that if people do the wrong thing, that they are punished. Police have a degree of discretion. That's a matter for them. They exercise that. What they're doing, what they're looking at, that's a matter for them. It's not for politicians to be directing them to charge people. But I'm confident they take this matter very seriously, and I want to thank the hundreds and hundreds of women and men of Victoria Police who were out there yesterday doing their very best in challenging circumstances. I think there were, and we saw up in Sydney as well, we saw some appalling behaviour towards police horses, towards police members. You know, punching horses doesn't work against the coronavirus. It doesn't work. It's also fundamentally wrong. Throwing things at female police members is pretty disgusting as well. So Victoria Police will do what they have to do, and we'll wait and see that unfold.
Premier, New South Wales Police have issued 510 penalty notices to people who turned out to protest in Sydney.
Sure.
Here, only 73 people have been issued with penalty notices. We still haven't seen the 3 Sydney removalists fined for bringing the Delta strain to Victoria. Is Victoria Police coming down hard enough?
You need to speak to them about that. They're doing their job. I'm not in a contest with New South Wales in relation to how many fines are issued. Police in Victoria will do their job, and they'll do it very well, as they always do. They take these matters very seriously. But again, you would need to speak to them about what they have done to this point, what they've done that none of us know about, you know, because that's the nature of some of this work. I wouldn't read anything into that, and I certainly wouldn't doubt how seriously Victoria Police take this.
Well, Premier, they're refusing to go on camera for the second day in a row, so we can only ask you, did police lose control of the situation yesterday?
Well, listen, I'm not here to run a commentary on Victoria Police. Victoria Police members did their very best yesterday, but if people are intent in the midst of a pandemic to break the rules, to be selfish, to act in that, you know, awful way, then it's very difficult within this is a pandemic. It's not a matter of, you know, grabbing people. That becomes an infection prevention and control problem all of its own. Police did their best. I don't think anybody who attended that protest were at their best. They were far from that. I'm proud of Victoria Police and the work they do, the risks they take, the sacrifices they make for all of us. Others may seek to criticise Victoria Police. I'm not one of them. And if you want further information about their investigative work, you can go and speak to them.
Well,
And I'm sure they'll provide you with whatever information they can, without necessarily tipping off the criminal element that they're after them.
Well, Victoria Police hasn't made themselves available to media today, so you're the leader of the state. We're asking you, should
Well, I am, but
Victoria
I'm not the leader of Victoria Police. And there is, by law, Victoria Police run their own show. They're not directed by me, by law. If you'd like me to intervene on your behalf and get them to go on camera, I'm more than happy to try and do that. But I'm not.
We'd love that.
Thank
you.
Well, good on you. That's terrific. I'm not. What makes you happy makes me happy. I'm not the leader of Victoria Police, and I've never pretended to be, and I won't start doing that now. But I wouldn't. I don't. Look, there's probably a lot of comparisons you can make with Sydney at the moment. That's not the one I would be focused on.
But many of these people, as you know, from low socioeconomic backgrounds, many of them have lost their jobs, they're distrustful of government to begin with. They probably will not be dissuaded from doing this again, given the kind of language you've used, even though a lot of people would agree with the language you've used, including most of us here. Have you considered using language that appeals to them to try and change their behaviour rather than demonising them further, even though that's the natural instinct probably of all of us?
Paul, I wouldn't presume to paint that group of people in socio-economic terms. I wouldn't presume, as you have just done, to make assumptions about any of those matters, where they're from, what impact the pandemic has had on them. No, I wouldn't necessarily agree with the way you've characterised them. I speak plainly. I try and be as frank and as direct and as honest as I can be in the language I use, and that's what I believe the vast majority of Victorians want. We're not cuddling up to these people, and frankly, seriously, I'm making a serious point. I don't know what half of them were protesting against.
You.
Well,
A lot of them.
then, well, good on them. Except it's illegal it's unsafe, it's selfish, and it puts at risk the hard work that millions of other Victorians are doing. And it's simply wrong. And if calling it out for the appalling behaviour that it is offends them, tough. They'll need to get over that.
Michael O'Brien has pointed out that there were no charges laid over the Black Lives Matter protests. Is it going to create an image problem?
Look, he is so irrelevant to the work I'm doing. I will not waste my time talking about him.
Sure, but
full stop. End of it. No, I'm not. No.
Can I rephrase the question?
Wasting my time on him or any of his colleagues.
Will it create a perception of double standards if there are serious charges laid from this protest?
You need to speak to Victoria Police. Politicians don't lay charges. Politicians don't lay charges. What's more, we've seen a bunch of people in our community who can't keep the same position for more than about an hour, right? So I'm just not wasting my time on them.
On something else, Premier, a woman in her 30s has died in New South Wales as a result of COVID-19. Do you have anything to say about that?
No underlying health
conditions either.
Well, we would extend our sympathies to the family of anybody who passes away as a result of this pandemic, whether they be at the end of their life or whether they be much, much younger. No one wants to get this. There's no such thing as a good case of COVID-19, particularly this Delta variant, and there's just hundreds of thousands of pages in medical journals that establish that as an absolute fact. Painfully, tragically, there's many personal stories that establish that for all of us as well. That's why protesting against this thing is just so wrong, just so wrong. If you are not persuaded by me on the issue of protests being, frankly, evil, then go and have a talk to the family of that poor woman who's died, otherwise healthy, struck down in the prime of her life by a global pandemic.
Puts paid to the argument, or that sort of outdated idea too, doesn't it, that it's only the elderly at risk? I mean, that person's younger than some of us.
Look, I don't know the details of the case, but I'll take your description of it as being accurate, otherwise healthy 30s. We've seen people across the world in exactly that circumstance and younger die as a result of this. We've seen some stuff coming out of the US where people in ICU are really at the end of their life. They're going to die begging to be vaccinated, being told it's too late. We've got to get vaccinated. We've got to follow these rules in the meantime. I know it's tough. I know it's difficult. No part of it is easy. But, we make these decisions to save lives. And I know it's difficult. It's very, very tough on all of us. But if we see this through, then we can get to a point by the end of the year where the Commonwealth Government secures the vaccine supplies, we get them into people's arms, and then 2022 can look very, very different.
Premier, just on vaccines, New South Wales has opened up an online booking system for younger age groups, those under 60, under 40 for Pfizer, starting in September. Is this something that we're looking to do in the coming weeks?
Well, we have a booking system which is being used for state clinics. I would encourage, particularly given the ATAGI advice in New South Wales, or in Sydney, as a result of their wave of cases. But I'd again take the opportunity to say, if you are interested in getting vaccinated, then talk to your doctor, because AstraZeneca may be an option that is available for you right now, as opposed to waiting for months and months for the Pfizer to arrive. So if your doctor says it's okay to take it, then that's a really important option. But it's not for me to tell you whether you should or shouldn't. That's a matter for you and your GP.
But for people who are waiting for Pfizer, are we going to start up an online booking system for those particular vaccines?
System now. We have a booking system now.
Can under 60s and under 40s right now book in for an appointment for a Pfizer jab from September onwards, when we have the biggest
people who are eligible. Well, let's wait. Look, I'm not here to criticise New South Wales, but if that's the number one priority for them, that's interesting. Let's wait and get the vaccine here first, rather than doing pre-bookings for stuff that's not on shore and won't be on shore for months. Anyway, that's.
So you're not confident we'll have enough Pfizer jabs for under 60s?
No, I didn't say that.
Who want them in September?
No, I didn't say that. What I said was we'll just work through this methodically, and we'll make judgments about what's most important each day, and we'll get all that done, and then we'll wake up again and start another day's hard work and just keep going day after day, month after month. That's how we do things. And I'm not saying it's unimportant, but that wouldn't be at the top of my list.
It seems as though New South Wales is doing that so that it can get the ball rolling and lock people into vaccination appointments, given that they're keen to get a vaccine.
Yeah, I don't. Well, hang on a minute. Your question gives me a bit of an opportunity to clear up another matter. I spoke with Gladys before National Cabinet on Friday, and it was very clear between her and I assume she might have spoken to other premiers from other states before the National Cabinet meeting. The National Cabinet was not going to be about trying to take vaccine from other states to put it into Sydney. It was instead going to be about cancelling all GP appointments for months across all of New South Wales, diverting that Pfizer to state hubs and having the state hubs vaccinate en masse people in the west of Sydney. That didn't happen because that's a matter for the Prime Minister, and I think you all know what his answer was. So please spare me discussions about pre-bookings in September. Right? There was a very different approach. There was a very different approach advanced by New South Wales on Friday. That didn't get up. Of course, we wish them well. We wish everybody well. And again, I'm not seeing a hesitance from people to book in or to get vaccinated. They want to. There are many, many more people who want to get vaccinated today than can get vaccinated, and I think that number will just grow as we all become, even more focused on getting to the other side of this. So I'm not here today to make any announcements about advance bookings.
But given the confusion from Atagi, just on that, there are still a lot of young people who are hesitant to have the AstraZeneca vaccine.
Then go and have a conversation with your GP.
But if they are waiting for the Pfizer jab, when do you think we will start an online booking system for those Pfizer appointments?
I'm not certain, but it'll be in good time, and we'll announce it when we're ready to do that.
Just on the next couple of days.
But I think we want to be confident that that it was a meaningful booking and that we had the supply, so that people weren't booked in for something that might not happen. Julia, that's the only point of difference between what you're putting to me and the answer I'm giving you.
Just on the next couple of days, you say that we might need to see Tuesday's results as well.
Potentially.
Do you expect an announcement Tuesday or Monday? And can I just ask on the factors leading into that announcement?
Sure.
Are the two kind of key things you guys are waiting on? One, the test results from the apartment block, and then also just making sure that no one comes positive from the Prahran Market infectious day. Are those kind of the two factors? All
of those and more. So there are a number of tests that are outstanding, whether they be day 13 tests of people clearing through ISO as a close contact, or other tests that are outstanding from exposure sites, the two that you mentioned being the most recent ones. We'll look at all of those. We'll try and give people as much notice as we can, and that means that we've got to strike that difficult balance between waiting to get as much information as possible and giving people as many hours notice as we can. But there'll be some discussions tonight, there'll be meetings tomorrow, and we'll make announcements as soon as we can.
Premier, on regional Victoria, do you expect that those people will get more freedom sooner?
No, I think that there'll be... it is my hope that we can, ahead of, hopefully, midnight Tuesday night, make announcements for the whole state and have settings that apply to the whole state.
Just on businesses, we've got Vecchi this morning pleading that as of Tuesday, we don't have to wear masks at our desks in workplaces. Yeah. No matter what we say about, or the announcement is about masks, they're asking that to keep people in CBD, workplaces. Is that a likelihood? With the greatest of respect to them and to everybody else who lobbies, and that's their job, I'm about making sure people can get out of their homes. That's what I want. I want to get us out of lockdown, and that will mean there'll be rules. And I think masks are going to be a feature for a long time, because as the Burnett, I think on Friday, released a really substantial piece of work that showed masks were pivotal, probably the greatest contributing factor to us defeating the second wave last year, 40+%. That becomes even greater when it comes to Delta and the aerosolisation of this, and strangers and, as you said before, people that don't even know they're in this company of each other, potentially infecting each other. So masks are going to be a feature of from now till we get the maximum number of people through the vaccine program.
The exact nature of that, though, will be based on health advice, and I'll have more to say about that in the next couple of days.
Just on that.
But I understand the point that they're making.
Just on that, a leading advisor from the World Health Organization was quoted in the media today calling for large sporting crowds to be banned and masks mandated post-restrictions.
Yeah, I saw that.
What do you make of that?
Well, look, there are many different opinions. With the greatest of respect to that person, I don't know whether he's a public health expert or
From the World Health Organization.
Yeah, well, there are a lot of people at the World Health Organisation. I don't take my advice from the World Health Organisation. I take it from the public health team here in the state of Victoria and others that operate at a national level, and people are entitled to their views. There are many of them. We'll get the best advice and we'll make the best decisions to keep Victoria safe.
Do you have any idea of what post-lockdown restrictions may look like? Will gyms be closed?
It's too early for me to be able to say what will be open and what will be closed. My aim is to have the 5 reasons to leave home off, to have people being able to have a much greater freedom of movement, for us to resume our economic recovery, and that's what we're after. But it's got to be done safe, and indeed, we want to get kids back to school, whether they be the littlest kids or kids that are doing their VCE. We want to get back to normal as fast as we can. I can't, and again, I've made this point many times, I will make it again. I know it's very frustrating. It's frustrating for me not to be able to necessarily have certainty about what's going to happen at midnight Tuesday night, but that's the nature of this virus. We've got to wait, see the results, see the tests, keep following the rules, keep doing the right thing, and hopefully we can make positive announcements for midnight Tuesday. And this will be the second Delta outbreak that we have seen off. Great numbers today, 100% of them locked away, no risk to anybody else. They are very, very strong numbers, a strong trend. We want that to continue. But even after midnight Tuesday, there's still going to be rules. There are still going to be things we all have to do, because this Delta variant is a wholly new enemy and one that we have to try and stay ahead of. You remember over this last week I've spoken a few times about running alongside this virus. We've been doing that. Now I think we've just got ahead of it. We have to stay ahead of it, though, between now and Tuesday night, and indeed every day thereafter, until the Commonwealth gets the vaccines here and we have everybody through that vaccination program.
Just on being ahead of it, this is the second Delta outbreak, as you say, we've got on top of.
Yep.
We effectively haven't had any significant transmission sites post-lockdown. All the big ones were pre-lockdown. That seems like a pretty solid feat by the contact tracers. Internally, has it been viewed as a real triumph of contact tracing this outbreak?
They're not sort of triumphant people. Neither am I. Like, you know, you have a win today, then you can have, you know, basically one or 2 seconds to be pleased about that, and then get on to the next challenge. This thing doesn't give up. It doesn't have a day off. It doesn't relent. It is there until we all get vaccinated, and even after then, what we see around the world is a pandemic of the unvaccinated. You know, we're going to have challenges for a long time, but no one's got time to reflect like that. But I would say they've done an amazing job, and it's why we've seen all these cases linked. And but you've got to give them a fair fight. I think you can't wait. You've got to lock down really fast. Otherwise, there's no chance that they can even run alongside this thing, let alone have any prospect of getting out in front of it. And that's why we took the very difficult decision very early on, with a very small number of cases, to lock the state down.
And for the rest of winter, given we know what Delta can do you think the public mood has changed and is now at the point that there'll be greater acceptance of quicker action and quicker movement into lockdown and quicker border closures than there were last year? Is that the sense you get in the community?
Well, the sense I get is that no one likes to be locked down, no matter the circumstances, right? But I'm not doing it for people to like me. I'm doing it because it's important to save lives. Look at what's happening in Sydney. On borders, I will venture a view on that. I think that people know and understand that what's going on in Sydney is not an outbreak. It's going to go on, it would seem, for months, and no one wants that here. We've been through that. We don't want to do that again. So what Victorians want is a hard border and as many restrictions as possible to keep people in New South Wales out of our state. That's why I've said a ring of steel around Sydney is something that should happen. That is my view. That's what we did last year, and it worked. And it worked. It protected country Victoria and it protected the rest of our country. That doesn't seem to be that's not going to happen. So we'll just have to make sure that the Murray and our permit system is as hard as it possibly can be. That'll be inconvenient for a lot of people.
That 2 weeks for that 2 week time period on Victorians not being able to return home from New South Wales, that's unlikely to be 2 weeks, right? That will extend.
Correct.
Yeah.
I think that's the honest answer. As case numbers grow in New South Wales, the risk of people coming here from Sydney is going to be higher and higher. So I think that we're going to need less and less of those people to do that.
Question for Jerome, if everyone's finished with the Premier.
If that's all right.
Yep.
Bill Shorten says Sydney is where the COVID trouble is. He suggested other states.
Sorry, who
like
said that? Sorry?
Bill Shorten.
Right.
He suggested that other states like Victoria should provide unscheduled doses to New South Wales. Would you support that?
Well,
Unallocated to me.
Yes.
well, National Cabinet will determine where vaccines are allocated with a plan that's been agreed by National Cabinet. What I will support is a JobKeeper type arrangement up in New South Wales. I think that's only fair. This is going to go for a long time, it would seem, and I think that Dominic Perrottet and Premier Berejiklian have sought that from the Commonwealth. I would say that was the right thing to do. I would just make the point, though, anyone who thinks that there are warehouses of this stuff that's all been allocated waiting to be put into people's arms, that's just wrong. Like, if we opened it up, we'd have queues that would, they'd stretch to Sydney almost, of people who want to get vaccinated today. They can't get vaccinated today because the stuff's not here. The Commonwealth has not secured the supplies that we need right now. I would say there's a lot of AstraZeneca available, and that's why it's important that every single person goes and talks to their GP and asks the question, is it okay for me to get AstraZeneca because I want to play my part and I want to get vaccinated now? And we may be able to get you through that system really, really fast.
Bill Shorten's also slammed the Hunger Games approach to vaccines. Do you think you or the New South Wales Premier has contributed to that mentality that it's state against state?
Well, it's not. So it's rather an irrelevant point. It's not. Just to be clear, I don't own the vaccines that are allocated to my state. They belong to the Commonwealth vaccination program. At National Cabinet on Friday, despite the fact I don't think there was really a request for Victoria to hand over any of the vaccines that are with us, despite what some might have you believe, I spoke with the New South Wales Premier before the meeting. I didn't go into the meeting with any great expectation that all of us were going to have to cough up our vaccines for New South Wales. That was not really on the table, right? What was on the table was the reallocation within New South Wales. I, however, made the point in the meeting that, noting that I don't own those vials, they belong to the national program, if you've got modelling, New South Wales, that shows that your strategy of vaccinating the West would work, bring that forward. And maybe we'd be all more likely to have a view that more vaccines should go there. I don't think that's too much to ask. I would just make the point, though, that there has been extra vaccine go to New South Wales. There were bring forwards that arrived unscheduled, and I understand that a greater share of those have gone to Sydney, not the pro rata share. I think that's good. Just like I think the JobKeeper thing should happen, because the need in Sydney is much greater than it is here, much greater than it probably anyone thought that it would be. This is not about anyone being mean-spirited or anybody being parochial. It's simply trying to be as evidence-based as we possibly can. I'm happy to have the discussion about sharing any and all resources. Just needs to be based on modelling and evidence, so you've got some confidence that what you're giving away will make a material difference to the person you're giving it to.
Do you think Brad Hazzard would agree that you're happy to have that conversation about sharing?
Well, I don't know Brad Hazzard, but I can tell you he wasn't at National Cabinet, so it'd be really hard for him to know what I said at National Cabinet because he wasn't in the room. Well, if he wants to know whether I was positive, negative, or otherwise, he should talk to his boss about what I said to her before National Cabinet and what I said in National Cabinet.
Did Martin Foley talk to you yesterday morning after his comments?
No.
Because he was pretty adamant that we were cooperating and all the rest.
We are absolutely cooperating.
But that Hazzard wasn't saying that you weren't.
Oh, again, if he needs to have explained to him what was said at National Cabinet, he should talk to someone who was there, namely his boss.
Just a question for Jerome. And is everyone
That's
finished?
a question for Jerome is a great idea.
Is everyone finished with the Premier?
Yeah.
This is, and I promise this is not purely a selfish question. There's other people who want to know as well. Pregnant women, what is the advice to them with the vaccine? Because there's a lot of confusion.
Yep.
Pfizer specifically, should they be getting it or not?
Yeah, so it's a very good question. I'm not a clinician, but I would suggest the ATAGI has issued advice that it is safe for pregnant women to get the Pfizer vaccine. We would therefore encourage any pregnant women that are eligible, please talk to your GP first. Make sure you understand and have any concerns and questions you have fully answered, and then come forward and be vaccinated either by your GP, because GPs have access to Pfizer, or of course to the state clinics.
And are they eligible simply if they're pregnant, or you've got to have other eligible?
I think they are eligible if they are pregnant. And again, the GPs in Victoria are starting to get access to Pfizer in constrained amounts. So please, I'd urge any pregnant women, please talk to your GP, talk to your clinician around what's right for you and how to get access to Pfizer.
During this press conference, a lot of day 13 people, for want of a better phrase, are saying, how will we know? Is it a phone call?
Yep.
Is it an email? They're
Yep.
desperate to get out and exercise.
Yep.
What exactly is the process?
So we have literally thousands of people making phone calls. We made 5,000, 6,000, 7,000 calls yesterday to people who are coming up for their day 13 test. So you'll receive a phone call. You might receive a text message. If we can't get through to you on the phone, we will let you know where your day 13 test is. If you're not sure, please call us and we'll go through the details with you. But you'll be advised, take your day 13 test at any testing centre in the state, over 200, and then wait for a call from us to finalise that clearance process.
So it will be a phone call.
It will be a phone call.
What are the biggest focuses for you in the next 2 days before Tuesday, Jerome? What are the things you really want to see? I know it's not your
Sure.
call.
Yep.
In terms of the outbreak, what do you want to see?
So I think from an outbreak point of view, that we've got a heap of activity happening at the Lacrosse building today. It's an even colder place than where we're standing right now. So huge numbers of people getting tested there. That's a big focus for us, seeing how that's going to go through, because we have recent infections that we're really concerned about there. We're obviously very interested to see that residual, all the testing results that are coming in over the next 48 hours. Where are those remaining positive cases coming up? Are they coming up in isolation? Are they known primary close contacts? And which outbreaks are they associated with? The picture has become a little bit more stable over the last few days, but of course we're only a few bad results away from having to detect a potential new chain of transmission. And of course, my final urge is for any Victorian who's got symptoms, we are still in this battle, and we will be in this battle for many months. If you've got any symptoms whatsoever, please get tested earlier. The earlier you get tested, the quicker we can determine whether you've got coronavirus, and if you do, we can protect you, your family, your friends and your loved ones.
Jerome, can you just clarify how many people live at that Lacrosse building?
So there is 214 residents we tested yesterday. We estimate probably about another 200 to 300 to test today. Okay.
Have there been any more wastewater detections?
No.
Just finally, if I can just send a clear message to all Victorians. Victorians are doing an amazing job. These numbers are the trend that we wanted to see. These numbers are more than promising, but we just have to wait and see what comes through tomorrow and Tuesday to be certain that we can ease restrictions at midnight on Tuesday night. I will foreshadow there will still be rules after midnight Tuesday. It'll be important that we all follow them. I don't want the amazing job that millions of Victorians are doing to be undermined or to be in any way disrespected or undervalued by the appalling behaviour of a small group of people. Let's focus on the millions of Victorians who are doing the right thing and have defeated a second wave already, have defeated a Delta outbreak already, and are well poised to do it for the second time. That makes Victorians unique. I'm grateful to every single one of them for getting tested, for doing the right thing, for following the rules, for playing their part in something that's so much bigger than any one person. It's a truly humbling thing to watch Victorians band together and do the right thing to defeat this virus, even though the virus keeps changing, which means our resolve has to be consistent, and we just have to see this through. I'm very proud of our state and very proud also to think that we are equal to this task. In fact, better than it. If there are any other questions? If not, very good, thank you.
Yes.
Thank you.